Welcome to HeInfo channel. Imagine this. You're sitting in a crowded room and your heart is racing. Your palms are sweating and it feels like the walls are closing in. For millions of people dealing with anxiety, this isn't just a rare occurrence, it's an everyday struggle. Did you know that anxiety disorders affect over 40 million adults in the United States alone? While many turn to prescription medications, there's a growing interest in natural alternatives like herbal supplements. But do they really work? Let's dive into the science and explore how these remedies might play a role in managing anxiety. Herbal supplements are natural products derived from plants, often used to promote overall health or address specific conditions. For centuries, people have turned to herbs like lavender, chamomile, and ashwagandha to ease stress and calm the mind. These supplements are believed to work by influencing the body's stress response or promoting relaxation, making them a popular choice for those seeking natural support for anxiety. While many swear by their effectiveness, understanding the science behind these remedies is key to using them safely and effectively. Below is a list of some of the more popular herbal supplements that may be used in the treatment of social anxiety disorder, SAD. Chamomile is widely recognized in North America, particularly as a popular ingredient in tea. Many people enjoy chamomile tea before bedtime, appreciating its traditional reputation for promoting calmness and relaxation. However, current scientific studies provide limited evidence to confirm its effectiveness as an anti-anxiety remedy. Kava Kava. Some clinical studies suggest that Kava Kava may be effective for managing anxiety. However, its use raises safety concerns due to the risk of liver damage, prompting several countries to issue warnings or even ban the supplement. If you are using or considering Kava Kava, it's essential to consult your doctor first. This supplement is not recommended for individuals with liver issues, liver disease, or those taking medications that impact liver function. Passion flower. Native to southeastern North America, passion flower is a climbing vine whose flowers, leaves, and stems are used to create supplements. It has shown potential for alleviating anxiety, insomnia, and nervous disorders. Since passion flower is an herbal remedy, standardized dosage recommendations are unavailable. However, research has suggested approximate dosages for different forms. Infusions, 2.5 grams, 3 to 4 times daily. Teas, 4 to 8 grams of dried herb daily. Liquid extract, 10 to 30 drops, 3 times daily. Tincture, 10 to 60 drops, 3 times daily. These amounts are general guidelines and not formal prescriptions. Always consult with a healthcare provider before starting any new herbal supplement. Rhodiola Rosea. Known as golden root or Arctic root, Rhodiola Rosea is a unique herbal supplement that thrives in harsh, dry, and cold climates like Siberia. It is classified as an adaptogen, meaning it is believed to enhance the body's ability to adapt to stress and increase overall resilience. St. John's wort. St. John's wort, Hypericum perforatum, is a flowering plant named for its vibrant yellow blooms, traditionally associated with St. John the Baptist's birthday. The term wort is derived from Old English, meaning plant. This herb is often used to improve mood and provide relief from depression, although its exact mechanism of action is not fully understood. Researchers believe that its active compounds, hypericin and hyperforin, may influence brain chemicals like serotonin, which is often found in low levels in individuals with depression. Many choose St. John's wort as an alternative to traditional antidepressants due to its lower likelihood of causing side effects. Valerian root. Valerian root, Valeriana officinalis, comes from a plant native to Europe and Asia. It has been used for centuries for its sedative properties, helping with conditions like arthritis, digestive issues, and headaches. Today, its most common uses are addressing sleep problems and anxiety. Although valerian root is not FDA approved for medical purposes, it is generally considered safe for adults when used short-term. Supplements are typically made from the plant's roots but can also include dried stems, extracts, or other plant parts. It is available in various forms, such as capsules, tablets, tinctures. There isn't a single recommended preparation or dosage for anxiety. Studies often use dosages between 400 and 600 milligrams daily, with the best results usually coming from starting with a low dose and gradually increasing it. For insomnia, dosages range from 300 to 600 milligrams of liquid root extract or 2 to 3 grams of dried valerian root, taken 30 minutes to 2 hours before bedtime. Lower doses are typically used for anxiety or nervous tension, especially when combined with other supplements. The exact mechanism by which valerian reduces anxiety is unclear, but it may influence the neurotransmitter gamma-aminobutyric acid, GABA, in the brain. GABA acts as an inhibitory neurotransmitter in the central nervous system, helping to reduce nerve activity and promote relaxation. While some studies suggest valerian root has mild sedative and calming effects, these results are less potent than prescription medications. Additionally, research on its efficacy for anxiety is limited and often affected by small sample sizes and methodological flaws, making definitive conclusions difficult. Winter cherry. Also known as ashwagandha or Indian ginseng, winter cherries has been traditionally used to help the body adapt to physical and emotional stress. It is a popular adaptogen, believed to enhance resilience and reduce stress-related symptoms. About the effectiveness of supplements for social anxiety. If you are considering herbal supplements to manage social anxiety disorder, SAD, it's important to understand that scientific evidence supporting their effectiveness is limited. The U.S. Food and Drug Administration, FDA, does not regulate herbs and supplements, meaning their ingredients and safety cannot be guaranteed. Since most supplements lack thorough testing, it is crucial to consult your doctor before use, especially if you are taking other medications or undergoing treatments. Herbal remedies should be seen as complementary to proven treatments for SAD, such as cognitive behavioral therapy, CBT, and selective serotonin reuptake inhibitors, SSRIs.